Thank you very much. To the Minister of Health and Long-Term Care. Mr. Speaker, the area around Branson Hospital has a high concentration of elderly residents, so it's clear that the Branson site should focus on senior care and include specialty clinics, outpatient mental health services, medical walk-in assessment services, day programs for elderly people, and multidisciplinary health promotion and health maintenance programs for local communities. Shockingly and sadly, the Urgent Care Centre at Branson is scheduled to close this June. Mr. Speaker, how can this government turn its back on these seniors?
Thank you, Minister of Health, Long-Term Care.
Well, Mr. Speaker, I think it was Branson.
Yeah,
it wasn't Brampton. Thank you. I just required that clarification. I'm not familiar with this specific situation, Mr. Speaker, but on the one hand, I'm happy to talk to the member opposite to get informed, to have a closer understanding. I'll be doing the same with my staff and the ministry over the course of the day. Clearly, Mr. Speaker, we provide the opportunity for our local communities to and our local hospitals and those that govern them to make decisions based on the priorities and the needs of their local community. It's critically important that as they make those decisions, they are able to provide that confidence and those assurances to the community that those services that they rely on are going to be provided. Again, I'm not familiar with this specific situation. Perhaps I'll get more information in the supplementary. Even better, Mr. Speaker, I'd suggest a conversation so perhaps we could work together to resolve this in a satisfactory way.
Thank you. Supplementary.
Thank you very much, and I'm happy to discuss it further. I understand that Councillor James Pasternak is going to be speaking to Toronto City Council about the issue, so I thought the minister would be aware. There are concerns that North York General Hospital does not have room to absorb all the services presently provided to the community at Branson Hospital, even if the elderly could make the trip. Mr. Speaker, the Ontario government actually promised medical services to be provided specifically to seniors in this area just south of my riding of Thornhill. In addition to seniors, the Branson neighbourhood has a high concentration of new Canadians who value the health care provided at the Branson site. Will the minister promise today to look into the matter and to ensure that the seniors, new Canadians and the rest of the residents of the Branson area in Northern Toronto will not be losing their cherished medical services? Thank you.
Thank you. Minister.
Well, thank you, Mr. Speaker. So as the member knows, this is part of North York General Hospital. My understanding from my staff is that the lease on this particular facility for Branson Ambulatory is due to expire in 2019. But I'm also told by my staff just now, Mr. Speaker, that there's a confidence that there will be no service loss expected as a result of these changes.